In Lewis and Clark County, sexually transmitted infections, or STIs, remain a quiet public health challenge. Behind every statistic, there are real people, real stories, and shared responsibility to stay informed and healthy. Over the past few years, STI trends in Lewis and Clark County have shifted. Some infections show progress, others a worrying rise. Let's take a closer look.
Hi, my name is Brenda Neiman. I'm the health officer with Lewis and Clark Public Health. Today I want to share with you just a little bit of data that we collect to help us understand the sexually transmitted disease impact that we have in our county. I have good news. For the most part, the sexually transmitted diseases that we track are all trending down. Chlamydia in particular, we've seen the largest decrease. So since 2017, we've seen a 73% decline in chlamydia cases. Gonorrhea cases have also dropped. So since 2020, we've seen a drop from 74 cases to 13 cases. Syphilis, we saw it double from 2021 to 2022, but since then we've had a 50% decline in syphilis cases. And then in 2020, we had 6 HIV cases, and last year in 2024, we only had 1 HIV case. So what this data tells us is that public health interventions work. What we are doing as a public health department and in our public health nursing team, those activities are helping to decrease the impact of STIs in our county.
What comes to mind is the wide array of diseases and infections that you can get from having unprotected sex.
Just that people aren't wanting to talk about it. They're embarrassed in the idea of that it would get out. So nobody wants to really have that be broadcast at large because it could maybe discourage others from wanting to be with them. It's just one of those things that people don't like to talk about openly.
I don't feel like really people around me, though my age, like my friends or some other friends of mine or my family, really talk about STIs as much.
People get embarrassed, especially if they have an STI. They don't want to talk about it. At least that's what I've seen. Like the gentleman said before, there's a stigma of STIs, about STIs. You don't want them. People don't want to know about them.
I think people are like kind of scared to talk about it, or they're very uncomfortable or ashamed to talk about STIs if they...
I would say less shaming of like if you did think you had an STD, instead of it being like you think you have an STD, of being like you should go get tested to make sure, because I think it's important to get it treated before it gets irreversible and turns into like something way worse.
Big thing would be just education. I don't think a lot of kids know it's even a thing or that there's treatment and where to go. So the public school system, I think, can do a great job at educating. Parents should be educating, just advertising, hey, come get tested, and making it a really open environment to get tested.
I would say for the younger generations growing up and being curious about sexuality, educate yourself. Know long-term consequences of your actions. So try to be mindful of what you're getting into and just finding support. So if you do find yourself having acquired a STI, know that there's cures for a lot of it, and surround yourself with a good support group.
Talking about STIs is important because they are preventable and treatable. Testing is available. The process is simple, and most importantly, it is completely confidential. For many young people, stigma is the biggest barrier. Yet, open conversations about sexual health can save lives, strengthen relationships, and build trust.
A lot of STIs, when tested positive, a patient just needs to take maybe just one round of antibiotics or sometimes a couple weeks of antibiotics depending on the STI. I just want everybody to know that it's a very normal thing to get tested for STIs. Some people come in once a month to get tested, some people come in every 3 months, some people come in once a year. It's a very normal thing to get tested and to ask for, but it can be anxiety provoking. And so talking to your provider or partner on what the best way for you to get tested is always helpful. There are a lot of options for rapid testing now, meaning that you can go to the clinic and get the test and know your results instantly. And so that can often reduce a lot of the anxiety around getting tested.
When people first come in, they're nervous. That's normal. Our jobs as nurses is to make them feel comfortable and explain the process step by step. No assumptions, no judgments. We want them to leave here feeling supported and informed.
A lot of STIs don't come with symptoms. Some people never get symptoms from having certain STIs.
That's why getting screening regularly matters. Getting tested once or twice a year if you're sexually active is important to keep you and your partner safe.
There's lots of different places to get tested for STIs here in our community. Our public health, hospitals, several clinics in town. But here at Peerview, we do offer all of the testing for all of the STIs. We also offer rapid testing for syphilis, HIV, and hepatitis C. We also, of course, work with our partners if somebody wants to get tested elsewhere.
Getting tested doesn't mean something is wrong. It means you care about your health. Talk to your friends, your partner, and your medical provider, because awareness starts with you.